All right, good morning, everyone. Good afternoon for the ones that are within Southeast Asia, but we have a big audience joining from Nordic, so good morning to the ones already online. Allowing some 2 more minutes for additional participants to join before we kick start. And also some instructions if we can ask everyone to mute, that would be fantastic. And of course, if you have any questions along the way, please raise your hand. Just for your information, we will record the session, so this will be possible for you to review afterwards as well and share presumably internally. But also, as in terms of a Q&A, we have allocated time at the end of the session, so you will have opportunity to ask questions as well during that time. So maybe perhaps take notes throughout the presentation and then save your questions to the end, and we will be hopefully able to address all of them accordingly. So I guess it's 2 minutes past 3 or 2 minutes past 9 a.m. as in Nordics. So welcome again, everyone, and very happy to see so many joining from Nordics, proving a good interest connected to the program we are currently launching. In close collaboration between 3 Nordic countries, Sweden, Finland, and Norway. Close collaboration between TPOs being Business Sweden, Business Finland, and Innovation Norway. My name is Kasper Pierzynowski. I'm Senior Manager at Business Sweden, overall project manager for this program, this initiative. I have also representatives from our respective neighboring countries from Innovation Norway and Business Finland as well. Niker from Innovation Norway in Singapore. We have also Mohammed from Business Finland in Malaysia joining, and a few others that at this stage will remain not mentioned, but thank you very much for all the collaboration across all the TPOs for putting this together. This briefing session regarding the Nordic Digital Health Innovation Challenge that we are actually launching right now in Malaysia. I will just to try to facilitate a little bit the session. We have 1 hour. So why we are sitting here today,
okay.
And why we are launching this initiative. I mean, as we all know, the COVID pandemic led to unprecedented disruption in both the global economy and healthcare in particular. This spurred a demand for digital transformation, in particular in areas of diagnosis and need for digital surveillance, I mean, remote care. Other solutions such as telemedicine to attend the patient needs remotely. So we see there is a I mean, as an outcome of pandemic, we see that including Malaysia, a greater rate of adoption of digital tools, digital features. As much as you know, majority of the countries are coming out of the COVID, and in some countries it's already putting in the past. We see that there is still a big need to address the other areas that remains to be prevalent in the world, but in Malaysia in particular, looking on non-communicable diseases, still being a big challenge, a problem, and growing burden that results in growing hospitalization rate, congestions at the hospitals. And in combination, I mean, there are challenges, but also there are opportunities deriving from the digital tools features and also patients' level of adaptability, as well as throughout the healthcare professionals, as well as healthcare facilities. We see a higher degree and higher need actually to deploy more solutions that will enable more, let's say, digital as well as remote care, everything surrounding self-management, self-care, self-diagnose, early detection. That means as well as improving the patient awareness around the NCDs, which is very important factor. For today's session, we have, as mentioned, allocated 1 hour. Agenda looks following. Without further ado, as the first point have been already covered as the opening, I'm very happy to have Dr. Faisal from Ministry of Health, our keynote speaker for this session that will help us to introduce, to set a little bit of a context. Dr. Faisal is a Deputy Director of Non-Communicable Diseases at the Ministry of Health, been collaborating with us in the past couple of years in different areas, presumably mostly around the non-communicable diseases and how we can address the growing prevalence through digital means. And very happy, without further ado, Dr. Faisal, the stage is yours. Please help us to understand a little bit the Malaysian context in relation to the non-communicable diseases.
Right. Thank you very much for the introduction, Casper. So good morning and good afternoon, everyone. So what I intend to do in the next 10 minutes is to provide a public health perspective of non-communicable diseases. I think that's one in Malaysia, and in particular, certain aspects that I feel that could be focused on with regard to digital health interventions. You could have the first slide, please. In terms of the burden of disease, NCDs remain the biggest burden as depicted in these graphics, where NCDs are the blue boxes and the green, the falls, road traffic injury, self-harm, also actually falls under the bigger definition of NCDs. So the burden of NCDs in terms of burden of disease for Malaysia, for both sexes and all age groups, is still predominantly in the NCD space. Next. In terms of the prevalences, that means the number of Malaysians living with NCDs, we in Malaysia conduct regular population-based screening, what we call the National and Health Morbidity Survey. The short form is NHMS. And the latest for NCD risk factor is for the year 2019. We do it every 4 years. So in fact, we are going to repeat this next year in 2023. As you can see, in terms of the prevalence, the first line, the prevalence of diabetes, Malaysia now has one of the highest prevalences of diabetes, not just in the region, but also globally as well. Our diabetes is basically 1 in 5 adults. Hypertension, almost 1 in 3 adults. If you combine overweight and obesity, it's almost 1 in 2 adult Malaysians living with either overweight or obesity. So we do have a very high burden of non-communicable diseases, and the increase have been more prominent over the years. Next. This comes as to no surprise, because when you look at the underlying determinants, this is where things are moving in the wrong direction for Malaysia. And I'll elaborate that in the next slide. Our National Health and Morbidity Survey also shows very high prevalences of common risk factors in terms of unhealthy diet, physical inactivity, tobacco, not so much alcohol use, so I'm not going to talk so much about alcohol, but in terms of risk factors, unhealthy diet, physical activity, and tobacco, that also is high. And just to highlight, I know perhaps I'm talking to people who are already familiar with non-communicable diseases. Next, please. Oftentimes, people living with NCDs have no symptoms. I will touch upon this subject again later on, and it is because they are asymptomatic, they do not seek treatment in our healthcare facilities. Next. Why I'm saying in terms of the underlying determinants, which is moving in the wrong way for Malaysia. So firstly, Malaysia is fast becoming an aging population. It is estimated by the year 2030, which is another 8 years, 15% of the population will be aged over 60 years and over. We are aging at a very fast rate, so fast that our health and welfare systems are struggling to keep up, as opposed to the Western countries where aging process took many more years. So you guys had more time to catch up, to build up capacity in the healthcare system and in the welfare system. The other aspect, which is moving in the wrong direction, is the Malaysia is fast becoming an urbanized country. Right now, we are looking at about 78% of Malaysians living in urban areas. And why I'm singling out urban areas, it is because health in urban settings have its own set of challenges in terms of unhealthy behaviors promoted because of the development which is happening too rapidly. So not just that rapid aging process, but also rapid urbanization. The other thing that I would like to highlight is the inequity in terms of poverty, not being helped by the pandemic, which has widened inequity, especially in the income. And now we are faced with additional pressure because of the increasing inflation, increasing prices of food, increasing prices of fuel. That has put more pressure in terms of poverty and also income disparity among Malaysians. And studies have shown that one of the main drivers of poor health is inequity and poverty. And lastly, there are these 4 things I would like to highlight is this issue about malnutrition paradox. We have both childhood obesity and childhood stunting as well. Why is this an issue? It's because, again, studies have shown that fat kids will become fat adults, stunted kids will become fat adults as well, and obesity, we see this in Malaysia in particular, is closely associated with diabetes. Whereas in Western countries, not so much, but in Malaysia, especially in other Asian countries as well, you see a close correlation between overweight and obesity and the risk of developing diabetes. So we have all these factors, just some examples, which is moving in the wrong direction, which is putting pressure on increasing the prevalences of NCDs, diabetes, hypertension, and the subsequent impact of cardiovascular diseases. Next. Right, so we talked about the burden itself. Now I would like to talk about NCD care. Oftentimes, a lot of digital solutions is very much focused on the middle bit, diagnosis and management. And I'm not going to focus so much on that because I think there is enough people talking about diagnosis and management. What I would like to focus on now is more on the proximal and the distal aspects, the tail ends of this continuum. Prevention, health promotion, early detection. There's more and more work on digital health solutions on early detection, but much less during rehab and palliative care. And why is, for example, rehab and palliative care is more important? I've already demonstrated to you the number of people living with diabetes, with hypertension, with high cholesterol is increasing in Malaysia. So you have the subsequence of the NCDs, like cardiovascular disease, heart attacks, and strokes, which necessitates services relating to rehab and palliative care. Malaysia is also fast becoming an aging population as well. So age, as we all know, is the main risk factor for NCDs. So there will be an even dire need, more need for rehab and palliative care. And we need to see how digital health solutions can support people living with NCDs to live well with their disease, for rehab and palliative care. For prevention and early detection, I don't need to make the argument that preventing is better than cure and the cost for prevention is much better. The other aspect that I would like to touch upon, could I have the next, just press next, is about the demand side. Oftentimes when we talk about solutions, digital health solutions, they are more focused on the giving up the services, making services available and accessible. What I would like to highlight during my session today is to think about the demand side. This is where the behavior of populations may be different. Your experience in Nordic countries will be very different from the behaviors of Malaysians in terms of demand. Okay? Just to prove my point, could I have the next slide? Sorry. So, maybe the next slide after. So I hope that with regards to the demand side, my hope is that we will find digital health solutions that provide tools, firstly, to help individuals and patients take responsibility of their own health, because that is something which needs to be further strengthened in Malaysia, and meet their needs across the different stages of their healthcare journey. And not just the middle bit, not just about the diagnosis and management, where a lot of solutions are focused on. We need to think about the prevention and early detection right down to discharge, rehab, and palliative care. Next. Why I feel that the demand side is important. Firstly, Malaysian population are not homogeneous, we are different. So we talk about vulnerable groups, which may include people from the lower socioeconomic classes. We know from our survey that they have lower levels of health literacy and lower levels of IT literacy. While you may read that the penetration of smartphones is very high in Malaysia, there is differences in terms of the types of smartphone and the way they access the internet. So I hope these can be taken into consideration when you think about your solutions, because this situation may be different from your setting. The third point I especially would like to highlight is need to understand the behaviors of Malaysians. And I've got some data to share with you after this, in terms of their health-seeking behavior, which is not so good, and in terms of self-care as well, which is not so good. Again, I'm generalizing. You will have populations, especially among the higher socioeconomic group and perhaps the Chinese ethnicity, who have much better self-care and much better health-seeking behavior, but they would be low risk for NCDs. So if you were to target the vulnerable groups, and this is where I hope that digital health solutions will not actually exacerbate any inequality which is already existing. And that's why my talk today is emphasizing vulnerable groups and addressing gaps where maybe people working in the digital health space do not talk about much the public health aspects. The last 2 points is in terms of the solution themselves. We see perhaps it's very more common where you are, but in Malaysia, I'm still trying to push this idea of co-creation. A lot of solutions in Malaysia is still very much expert-driven, not really taking into account the perspective of the target population, especially if you're targeting the vulnerable groups, right? And how much do we incorporate behavioral insights in terms of our solution? This is, again, relates to the earlier point about understanding the behaviors of Malaysians. Next. So just some data to share with you, and this is where our surveys have come into play. So from the last National Health and Mobility Survey in 2019, we found that 1 in 3 adults have low health literacy, and we will be repeating that same survey in 2023. We did a quick survey among type 2 diabetes patients who seek treatment in MOH health clinics, again, just before the pandemic. And the question was, what is their preferred source of information? As you can see, the preferred source of information is still face-to-face for these patients and traditional media, okay, followed by new media. And when you look at new media, it's WhatsApp being the most favored. And this is for source of information. And we did ask specifically about apps, and apps present only 9.2%. And this should not be too surprising if you knew that the mean age for type 2 diabetes patient in MOH clinics treatment is in the age of 55 to 60 years old, and they are also more likely to be in a lower socioeconomic group. So, I mean, if you knew that, then it wouldn't be as a surprise why these are their preferred source of information. Next. So anyway, the other considerations that I hope they will think about working in proposing solutions in this country is to look at the current regulatory ecosystem, which will be different from where you are. You will also need to take into consideration the current status of medical and health records in a lot of public health, in the public sector, it is still paper-based, although more and more facilities are transitioning to clinical information system, different from the private healthcare sector in Malaysia, which is more advanced in terms of the utilization of clinical information systems and EMRs. The last 2 points is because of the pandemic. I would like to make these 2 specific points. The pandemic, although has been damaging in terms of the Build Back Better agenda, there are many learnings that we could take from the pandemic in terms of the response that could be applied for NCD's response as well. And the other aspect which I have not talked about is the mental health aspect, the collateral damage to health due to the pandemic, especially among vulnerable populations. Why I'm singling out mental health? Because mental health has impact on the outcomes for NCDs, both for people living with NCDs, and also increases the risk of developing more NCDs. So because of the pandemic, in addition to the other drivers of NCDs in the country, I'm very, quite pessimistic about reducing the burden of NCDs the way the current trajectory is. I think that's it, right? And my key points, last slide. In terms of intersectionality, just to recap the earlier points that I have made, I hope we are not too obsessed about the engineering part of the digital health solutions. I think oftentimes my experiences with people working in the digital health space, I think there is too much focus on the medicine side and on the engineering side of it. People forget that it's easy to forget that you need people to interact with your solution, and that interface between the machine and the people is something that people often overlook. And I've had much learnings from my experiences in implementing digital health solutions. For the sake of time, I didn't include this, but I hope that people think about this intersectionality, not just engineering and the medicine, but more so of the human behavior and also the public health aspects, which is very context specific. So while yes, there is much to learn from implementation in other countries, we certainly need to take into account the behavior, the context of Malaysia, should we want to see success in implementation of our digital health solutions. And in summary, my last slide, my key takeaways, don't get me wrong, I firmly believe that digital health is the way forward. I think it is how we apply it will be the key thing that we need to find a way to make it very effective and most efficient so that we get the bang for our buck. We need to address the intersectionality of digital health, behaviors, and public health. 2 ways to address this: co-creation and incorporating behavioral insight. From where I sit at the ministry, I have to think about how to upscale. So even if a solution works in a very small setting, the main question in my head is it scalable? And how much resources do I need to scale it up? And if we think about scalability from the beginning, and digital health solutions have the added advantage of addressing this, then we are on the right path. And my last point is that we need to have a detailed evaluation, especially process evaluation. Not everything will turn out the way we intend it to be in terms of reaching its objectives, but certainly there are many learnings along the way. And the more we can learn, the more we don't repeat mistakes, and the more we can document them, the more others can learn from our mistakes and hopefully don't repeat those mistakes moving forward. I think that's it from me. Thank you very much. I'll pass the floor back to Casper. Thank you very much.
Thank you so much, Dr. Faisal, for the very insightful and very clear message. I mean, we see that the prevalence and there is a growing burden of NCDs, and not only Malaysia being exception. I mean, there are certain conditions and underlying factors, the behavior that perhaps drive and set Malaysia a little bit, let's say, more prone to certain diseases. I mean, being, as you pointed out, in regards to diabetes, scoring unfortunately high in relationship to the Southeast Asia, but even globally. We see that as a growing challenge, and this is very much about what you were been discussing and pointing out about the behavior. I think, you know, there is a greater need to work towards the early stages of the let's say patient journey, as you pointed out, prevention, early detection. This is where the focus should be, and I hope the participating companies from Nordics have been also addressing that area, and hopefully we can come up with relevant solutions for Malaysia to actually explore the implementation. Obviously, everything needs to work in the local context, so also translates into needs of running the local proof of concept as well as trials and testing, just to make sure that everything is being adapted accordingly to the local behaviors. But yeah, I hope we have good solutions, and there will be opportunity to ask questions to Dr. Faisal at the end of this session, so please take notes. I will now, from our side, would like to walk you through hearing and understanding the challenges. As I mentioned before, we have joined forces with Innovation Norway, Business Finland, and Business Sweden to actually facilitate a Nordic Digital Health Innovation Challenge to actually invite and evaluate Nordic solution providers addressing the non-communicable diseases to participate and to get acquainted with the local context, as well as participate in the explore the market here in Malaysia and Southeast Asia for addressing those challenges. So let me just recap a little bit about the challenge itself. I mean, the rationales already being clearly set and explained by Dr. Faisal. We see that the prevalence of non-communicable diseases and related risk factors in Malaysia has risen substantially, and this is a kind of a growing trend. In some dimension is being reduced, but in general, the non-communicable diseases still maintain and remains a challenge and a growing prevalence of it. With this innovation challenge, we would like to identify a solution, technology providers that have relevant solutions that could enable early detection, prevention, screening, also working with the patient awareness, because as Dr. Faisal mentioned about the behavior, I mean, we need to understand and have a right level of communication to the patients through different means. We know there are, you know, certain areas and aspects to take into account, being the digital literacy, as well as how the Malaysians are seeking the advice and the diagnose. Majority still preferring go straight to the doctor, but also throughout the pandemic, we have noticed that in many cases that option have been not possible, and different means of telemedicine have been gradually being implemented in order to facilitate that more remote set of communicating and having the interaction with the patient and the healthcare professional. We are not looking into, we are not narrowing down the scope in terms of NCD areas. We know those the highest burden being the cardiovascular diseases, chronic respiratory diseases, and related diseases to that, diabetes, being those three main let's say factors, or let's say disease areas within NCDs that Malaysia is challenging. But we also equally interested in the solution addressing hypercholesterolemia, cancer, CKD, and also mental health, which we cannot exclude from that equation. So we are looking for the solutions broadly that covers NCD, because we believe that it's cross-cut pretty much the demand here in Malaysia. So essentially, what we are trying to do here with our Nordic friends is actually to recruit Nordic innovative solutions, but also innovative solution to that degree that they fit also the local context in terms of the digital literacy that Dr. Faisal was pointing out, not only addressing the top tier population, but also the most vulnerable population. So different type of aspects need to be taken into equation. So eventually, what we are looking at, early detection and management, solutions that can improve the early detection and self-care and monitoring of mentioned diseases. Mass screening, solutions that can be deployed both on the primary care level, tertiary level, presumably, but I would say primary care level is the first front line of connection, and on the GP level, we would like to see how the solutions can be deployed there. And mention those two aspects about patient awareness. Solutions that enable patients to get more acquainted with the conditions, pre-assessment, tools for the pre-assessment, self-management, self-care, pre-diagnosis in order to identify the symptoms. Some symptoms are asymptomatic, as mentioned, but we believe there is more things to be done here as well as on that level, as well as with all respect to the great healthcare professionals here. I mean, there also needs to be addressed in terms of improving the doctor awareness and also enabling doctors to be better connected with the patients through the remote means, as well as application tools, platforms, in order to manage the patients better, to inform patients and to monitor patients in a better way. So this is the sort of the targeted solutions, but we are very happy to open up for more. We believe there are very interesting solutions out in the Nordic markets that could be of relevance for us to evaluate. And about the evaluations, so we are forming a steering committee that will be responsible to evaluate all the applicants that would like to participate in this innovation challenge, looking on 4 areas equally weighted, connected to the impact. Is the solution design well thought through? How to be accepted by the target population? Feasibility, practicality of implementation within an existing system and policy framework. And also uniqueness, how innovative and novel the solution is. It's important also to take this into equation. And scalability, that what Dr. Faisal was mentioning, how the solution can be taken to the next level. We test it in a closed environment. I will explain it shortly, but how, if it works, how it we quickly upscale and deployed broadly, and how does it translate into resource needed to manage it. So we are looking into those aspects, and the committee will be established with experts from Ministry of Health. We will have our Nordic TPOs also participating in this group, as well as other actors from the innovation spectrum in Malaysia, because we are also closely collaborating with various innovation hubs in Malaysia, where they're working actively in providing the proof of concept sandboxes, as well as accelerating different digital technologies to be more tailored for the Malaysian context. So we will work, this steering committee will comprise of different people that have relevance to set kind of a to evaluate basically the seeking solutions here, understanding the local context. So why, for all participating Nordic companies, why you should consider joining this innovation challenge? First of all, we are looking, from your perspective, you should look into network. I mean, gaining access to the regional innovation networks for knowledge sharing, product showcase, and market expansion. Proof of concept, saying that we have working closely with different institutions as well as hubs that enables you to test your products and trial your products in order to make sure that they are compliant as well as fitting the local context, sandboxes. Mentorship, again, access to the network of local global experts to further develop your solution, to adjust, to tailor your solution to the local context and the regulations. Last but not least, also funding. There are some interesting schemes in Malaysia that we are working closely with that will enable you, for the purpose of testing, implementing, working with the proof of concept, you will have opportunity to gain access to the funding to test and scale up your solution. With that said, I also would like to just highlight just two examples of the benefits from participating in this challenge. There are two interesting avenues of many, I would say, but those two just would like to highlight to give you a little bit of a flavor and context. One being the National Technology Innovation Sandbox. This is a government-led initiative cross-cutting different type of industries, but lately healthcare become quite targeted area, I would say, not least driven by the pandemic and also the urge of implementing and nurturing the digital health solutions in the Malaysian context. So what this program offers is basically capacity building programs, market access, funding, test beds, and test environment facilitation in the regulatory compliance, basically. So for you as a Nordic company, you will get access to network for product development, adoption, testing, and regulatory compliance, essentially. There is a new sandbox that will be launched in June, July, that will allow access for the relevant companies, and you're including as well, to test and pilot your products in the live scenarios at the public hospital and there are public and private hospitals included. Another one, NDEC, being the Malaysian Digital Economy Corporation, a government agency under Ministry of Communication and Multimedia. This is the aspect of innovation. They have just recently announced, and we are in close dialogue with them in regards to different type of grants, a global technology grant and for IR Catalyst grant, which essentially means that is access to funding for research or innovation, development and commercialization of innovative commercial products or services and development of solutions in partnership with end users. So yet again, everything connected for you to be able to test and expand your solutions in the local market in Malaysia. So this is essentially the scope, I would say. I would like to touch upon the timeline for this. So we are today at 24th of May, the briefing session. Week after, 31st of May, we will launch the Innovation Challenge. All companies that have registered and the ones that are participating here today will receive an invitation to the challenge with that will have embedded application form for you to be filled in, and this information will go accordingly to you. Then between 1st of June and 1st of July, the application period will be open. So this will be a time for you to submit the application. And at the same time when the steering committee will gradually start to evaluate. During the July month, we will work closely with the steering committee to evaluate and to select shortlisted solutions that then will be invited in the beginning of August to a meet and present round to the partners in Malaysia, including Ministry of Health and other mentioning here different type of innovation hubs that we are working closely with. Then the final selection end of August, beginning of September, and then during the September or October month, we are will be welcoming the selected companies to visit Malaysia, to get on board to different programs and initiatives, to get opportunity to test, pilot their solutions here, and to get acquainted and build a network in Malaysia to actually grow and adapt the product accordingly. So that's in a nutshell the timeline. So from the practical point, I mean, just to prepare you for what you will expect to receive on the 30th of May is application form, a link to the application that we would like to ask you to fill in. Then the application will be also embedded the challenge official information and rules. And for any questions moving forward, that will be also shared over the email to all participants. If you have any questions, we have I have my colleague Henrik Zygmunt that will be able to cater for all the questions related to the challenge and the process. And obviously, I mean, when you submit the application, all the supporting information in regards to the company presentation, videos, all the supporting documents will be very much welcome to receive. That will support the evaluation process on our end. And yeah, I mean, we will be very close in contact with you, with the companies that are interested in this to further facilitate the process related to this innovation challenge. So in a nutshell, we have 1542. We have quite a good time for any questions, both to Dr. Faisal and myself, that we are able you are able to address right now. So please feel free to either unmute or raise the hand, and we will be welcome to, you're welcome to ask any questions pertaining either the landscape, NCD landscape in Malaysia, or specifically pertaining the challenge that I have just walked through. Yes, we have Masood with a question, please.
Yes, thank you very much for very nice presentation, Dr. Faisal, and the inside information, and Casper as well, to arranging this call or meeting. My name is Masood Jadidi from Imaging Care. We are working with remote patient monitoring in Sweden in the regional wide solution. So we have 2 regions in Sweden that is working with patient remote monitoring at home. Actually, I go directly to my question. There are a lot of initiative from the government, completely understand is done and is challenging when it's coming to behavior. And I agree with you, Dr. Faisal, the behavior is very, very important. Even in Europe and Sweden, we have the same challenges. My question is the initiative from the government, when is the coming to reimbursement model, and how the government can support the foreign company with some innovative solution is coming, and because we are believing to have proactive solution, not reactive. The healthcare in general is very reactive. But in anyhow, how the government financing and what is the reimbursement model in the country for digital health solution?
So thank you for that, Casper. Can I just respond straight away?
Yes, please go ahead, Dr. Faisal. Yes.
That's a very valid question, Masood. Thank you very much for that question. Just to provide an overview, Malaysia has a parallel both public and private healthcare. In terms of the healthcare expenditure, it's almost 50% public and almost 50% private. But in terms of patient burden, it's almost 80% going to the public sector. And health, we only spend about 4.1% of our GDP. and less than 2% in the public healthcare sector, which is very low. So why I'm saying this is basically there isn't any reimbursement model right now. However, the current health minister is a very progressive person. He is pushing for digital health solutions. He has in fact made it his personal agenda to lead the healthcare transformation. Okay, fine, healthcare transformation is not new. We have talked about it in Malaysia from the 1990s, but he is the first person to want to do it as a bipartisan. That means it's not linked to him, it's not linked to the ruling government. It's going to be, bipartisan. So I'm quite positive on that. It is sort of a chicken and egg as well. We have not seen a good model that we can reimburse, but at the same time, I understand for companies to invest, they would like some reassurance of that component. I think the other thing that you have not asked is the regulatory environment. So that is something that Malaysia is also moving forward quite strongly, and we hope to have a clearer framework by the end of the year. In fact, they have created sort of a sandbox already. So while there isn't any reimbursement for the public, for the private it's very much out of pocket right now. Even in the private sector, it's only about 12% is about insurance. About 38% is still 34% is out of pocket, which is for an OECD country is very high. You understand that. Regardless, while I say we focus more on the for the vulnerable groups, people living with NCDs come from all sorts of socioeconomic background, right? So as long as it benefits people, we would look at your solutions. Sorry, Mr. for the long-winded response.
Thank you, Dr. Faisal. And we have a question from Ula Peter.
Yes, hello. Good morning or good afternoon, depending on where you are. My name is Ole Petter. I'm a medical doctor and one of the founders of Nordic, which is Norway's largest digital training center. I have a question for Dr. Faisal, and I assume that the Malaysian government has some national recommendations when it comes to exercise for the population. Like most other countries, in Norway, we have 150 minutes per week. Do you have any data saying something about how many % of the Malaysian population currently meet those recommendations?
Yes, we do. The population-based survey right now uses what we call the IPAC questionnaire. So based on that questionnaire, we see about 60% of Malaysians are meeting the recommendation. However, allow me to say that, however, we see a mismatch between level of physical activity as claimed by respondents versus the level of overweight and obesity. So, with any self-reported questionnaire, we interpret that with a bit of skepticism. I would have liked to see more objective measures of physical activity, but none of that have been done in Malaysia in terms of, using accelerometers or something like that, more objective. So I would say, while the data shows we are relatively active, but in terms of overweight, obesity, the numbers still going up. So there's a mismatch between what in terms of data we collect, level of physical activity, and the level of overweight and obesity.
Yeah, certainly. We see in Norway when exercise is self-reported versus measured objectively with accelerometers, we see that there's almost a 50% over-reporting when it comes to self-reporting exercise compared to the accelerometers. Thank you for your answer.
Thank you.
So there already some similarities between Norway and Malaysia in that regards. We have another question from Oivi and one other I cannot see. Maybe Henrik, you can help me.
Yeah. So Good morning and good afternoon to everyone. Firstly, thanks for inviting us for this session. I am from Team OIV. We are a company based in Norway doing some great work in the space of diabetes retinopathy screening. I would want to have some metrics with respect to what is the impact, or what is the incidence of number of people having diabetes in Malaysia. Was any recent survey being done? And then what is the impact of DR, diabetes retinopathy in Malaysia, so that it will basically help us to come back with some innovative solutions and ideas going forward.
Right, Avi, can I just confirm with you the later part of your question? You're asking about diabetic retinopathy or nephropathy?
Retinopathy.
Retinopathy, all right.
Yeah.
Okay, so in terms of prevalence, as I've indicated earlier, we estimate about 1 in 5 of adult Malaysians, 18.5%. Of adults 18 years and above have got high blood sugar. This is on the population-based survey. Out of that 18, roughly about 9%, 1 in 2 are diagnosed. So we know about half of them with high blood sugar are not diagnosed. And out of those diagnosed, for those who are seeking treatment in primary care, only about a third could achieve optimum HbA1c levels. The reason we have data for the primary care is because we have a national diabetes registry, which is under my supervision. In terms of diabetic retinopathy at the primary care, we are looking at about 8%. However, we think that it is an underestimate because it is a primary care database. Usually people already diagnosed with complications, be it retinopathy, nephropathy, heart attacks or stroke, will be referred to a tertiary care hospital. And we would lose them from our registry because our registry is basically very much primary care based. There isn't any linkage with the hospital data. So there is a lot of potential, there is space for us to do work in the area of making retinopathy screening. But the thing is, as part of the clinical practice guidelines, it is very clear that all healthcare practitioners need to do screening once a year. However, we know implementation is a bit different from our recommendation. It's not so much the issue of having access to fundus cameras. A lot of clinics, even the public clinics, do have fundus cameras. It is an issue about people not coming forward to do their screening themselves, the way our health system is set up. So yeah, short answer, very high prevalence. You would expect the complications prevalence to be high as well. And there is a lot of space to look at the complications relating to diabetes.
Thank you, Dr. Faizul. And what I hear from you is, yes, there is prevalence, but a lot of people do not come forward for screening for DR. If in the interest of time, can I just continue the question, or there are more people in the house asking for?
No, I mean, we can accommodate a follow-up question and also encouraging other also to take opportunity. But please continue.
Yeah. So my just follow-up question is, any reason why we basically have seen that there are no follow-ups for DR screening? Is it because, as you mentioned, 80% of the spend is out of pocket and only 13% gets spent?
Nope. So that's one of the challenge that, thank you for raising that, and that's something that I'm trying to address quite actively. So we're looking at basic screening. When I say basic, it is BMI, blood pressure, blood sugar, blood cholesterol. It is not an issue of accessibility and availability. Even in the private sector for vulnerable population, the government is subsidizing almost for free. So in fact, Malaysians can walk up to a GP, private practitioner, private health clinic. If they are eligible, meeting the income criteria, they will get screened for free for not just blood pressure, blood sugar, but also for clinical breast examination, for pap smear for ladies, and also for fecal occult blood to screen for colorectal cancer. So the issue is not accessibility or availability. There are several smaller studies that have been conducted, especially targeting at males. So the research are basically looking at men's health. That's why I'm quoting, because most of the research looking at females are more in the cancer space, cancer screening space. So some of the main challenges that have been described for specific population is that they would rather not know. Basically, ignorance is bliss. So
Okay.
if they know, that's one. The other thing, they are scared, relating to ignorance is bliss. Health is low in their list of priorities. So that means I'm young now, I will not think about my health. I'll think about it when I'm older. And some of them are from misplaced belief that you only get disease when you screen. So if you don't screen, you don't have a disease. So maybe it's ignorance is bliss. So these are some of the challenges. Of course, I mean, I can share some of the papers with Casper, perhaps something that I can share forward in terms of in fact, there is a compilation. Oh, okay, I can share that with you in terms of the barriers that we have examined and we have confirmed, because there are many more studies in developed nations that, but there are already some studies in Malaysia that concurs with some findings from other countries, but also some unique insights that's quite unique for Malaysians.
Thank you. Thank you very much. Thank you very much, Dr. Faisal. This really helps us.
Thank you, Dr. Faisal, and thank you for good questions so far. We have 3 more minutes, maybe some last questions from participants. That is a great opportunity to address, and obviously we will be able to accommodate more questions afterwards. And as mentioned, the timeline for applications is quite, I would say, long. Or manageable to have a further tailoring. So just making sure that there is a sufficient time for you to participate. We have one more question here from Arnulf, please.
Yes, hello, I'm Arnulf Refsnes. Thank you very much for a very good presentation. I work together with Ole Petter Gjelle, who also asked a question here. In Nordic, we are very big at helping people gain some fitness goals and making people move. And my question is around medical doctors, and do they have any way in Malaysia where they can actually prescribe training or fitness in any way? Is there sort of a system for that, or do they have any tools they can use, or is there a code they can write in some sort of prescription? You have to do exercise.
Right. The reason why I'm smiling is the answer is no. There is small movements. There are a small group of people talking about prescription. I mean, exercise as a prescription. I think basically that's what you're saying. A lot of proponents, champions here, small champions working in silos. In fact, that's one of my smaller projects. I'm working at a smaller scale with colleagues. In fact, I have managed to get some funding from Norway, actually, going through WHO. Just so you know, so Norway have provided some unrestricted grants to WHO, and WHO have channeled it my way to support basically what you're saying. So I see potential, not just in the public, but more so in the private sector, looking at prescription, looking at the burden of the obesity, right? I think this is where it would benefit the most, because there are less pharmacological interventions available, and whatever is available is very difficult to use, a lot of side effects anyway. So potential, but not enough champions. So if we can identify more and more champions, that's certainly something that in my position in MOH, something that is quite high up in my agenda.
Thank you.
Let's see. Okay, unmute. Right. So I think we have reached top of the hour. Thank you. Not keeping you longer from other activities you need to attend. So first of all, Dr. Faisal, thank you so much for your time, and thank you for all the insights and also addressing very good relevant questions in relationship to the Malaysian context, and because this will also give a little bit of a guidance for the Nordic health tech solution providers to adjust, coming with the right value proposition that meets the expectation and the local context. As said, we will share the materials after this with all the companies that participated, and also the one that didn't manage to arrive in this meeting, the registered ones. So we are looking forward to receive many interesting applications and to see many of you in Malaysia in the second part of this year. So thank you once again, everyone. Thank you, Dr. Faisal, and wishing you all good day and afternoon. And we look forward to reconnect with you as well very shortly. Thank you so much.
Thank you, Caspar. Thank you everyone for the great set of questions. Thank you.
Thank you.
Thank you. Bye.